honored to be here tonight. And I will try to tell you a little bit about my specialty. Now, it is said that in the civilized world, about 80% of people, of the population, are touched by radiology one way or the other. If it is not the person himself or herself, it's a member of the family. Sorry. Member of the family. So you could imagine the number of people worldwide, the billions of people actually who are exposed to radiology, yet few, perhaps, a small proportion, know enough about it. And I don't know how much of you, or how many of you, know enough about radiology. So I hope by the end of the talk tonight, you will know a bit more about it. And please, I would like to answer questions at the end, but if there is a very pressing question you want to stop me, go ahead. Right, thank you. So, where radiology started with X-rays, and X-rays, as many of you will probably know, were discovered in 1895, incidentally, by Röntgen. And it's basically a radiation source and a receiving medium. And the X-ray itself will penetrate all the soft tissues, but will not penetrate solid tissues like the bones and metal and all these things. And this is where the value of it arose right from the beginning. I can tell you a piece of information to just emphasize the entrepreneurial work in Lebanon. X-rays were discovered in 1895. By the 1896, there was a small X-ray machine in Lebanon working actually somewhere in Lebanon. And by the end of the century, there were 2 centers in Lebanon providing X-ray examinations. So things have not changed. They're still the same actually a century or more later. This is the famous picture of Röntgen, and the more famous picture of the hand of his wife that was exposed incidentally, as I said. And this is where X-rays were discovered. Is the microphone working well? I'm sorry. Yeah, so it's all right? Fine. So we start off with what we call plain radiographs, and these are the simple X-rays that are done the same way that the hand of Röntgen was exposed, and they show bones and they show areas of what we call calcification, and they provide a topographic view of the soft tissue anatomy. And these provide a single plane view. That's a 2D view of a structure. So the chest X-ray will be a 2D view of a volume. Nevertheless, there are ways to ensure that the X-rays cover, or the X-ray cover every aspect of the organ that we are looking at, for instance, in the chest. So here's an example of an X-ray. You recognize the patient, I hope. And some of you will probably tell me that this is Lo'os Ramli. I think it's probably Lo'os Ramli. You can see the bones, and you can see the surrounding soft tissues right in here, and you can see that this patient had been killed, unfortunately, or fortunately for purposes of human use. So the same principle applies actually when we look at organs. Of course, the invention of X-ray changed the world completely. And later on, as years went on, there were usages for the X-ray that now are obsolete. This is, for instance, one way of looking at the sinuses in patients. And you will not be surprised, particularly the ladies, to hear of the creams and things, lotions that were invented that were supposed to be radioactive, and they were supposed to provide everlasting youth and beauty to people, women mostly. And you will not be surprised to hear of clandestine, if you like, efforts by people to advertise X-rays as ways of exposing people's inner selves, through either spectacles or things, which in fact they did not work. But here you can see an advertisement for one such contraption, apparently showing the bones and showing the undergarments. Well, I can tell you that this doesn't work. Neither then nor now. So, what does the X-ray machine look like? Here's an example of several X-ray machines. This is a static one and fixed one. This is a mobile, or these two are mobile. And they consist of an X-ray tube that produces the X-ray, that's the X-ray source. And somewhere there will be a film, like this film, in this technologist's hand, that will receive the X-rays and produce the image in the end. Of course, in the old days, we used to have dark rooms where we processed the X-rays. Now we no longer do that because we, as I will mention to you later, we have something called digital imaging, which has changed things a little bit for us from that perspective. And that is a recent development. We'll talk about it in a few moments. Here you see the inside of things when you put an X-ray, you do an X-ray. And is there a risk from these X-rays? Of course, any radiation, in the early days of radiation, people were not aware of the risk, and people developed cancer of the skin from exposure, large exposures to this radiation. Of course, now we are very careful about this, and we know about it, and the risk is very minimal. And you'll see here, for instance, a list of exposures from common films. Now, I can tell you that, in fact, I'll tell you in a few moments. Let's move on to the next one. That we as radiologists are entitled to be exposed to a certain dose every year. And this dose is very strictly monitored so that we don't exceed it. And if we do exceed the dose for whatever reason, we have to stop working for a period of time. If we do exceed the dose, we have to stop for a period of time so that we don't exceed it anymore. So this is very strictly monitored. Again, technologists are the same. Anyone who deals with the radiation has to be monitored for the dose that they receive. Now, this is for us. I mean, we are the people who are actually exposed to radiation during our work all the time, or most of the time. I'd like you to look at this figure here. And I'm going to go back to this figure here. But they're different units, because one measures the surface exposure and one measures the depth exposure. So you'll see that this is, for instance, a chest X-ray. It has a milligray value of this. All right. And as a radiologist, I have a millisievert value of this. These are two different units. And then here's how we are monitored. So you can see that there is something called the TLD that has a little film inside it. And the TLD measures the radiation that we are exposed to. We have to wear it all the time. Anyone who deals with radiation, whether it's a cardiologist doing cardiac studies, or whether it's a surgeon doing anything with X-rays, has to wear one of these. And now you notice that there is a figure here of 2 millisievert. Now the 2 millisievert is the exposure that each and every one of us gets in Lebanon. And the exposure comes from natural radiation, from the sun, from the earth, and this is what we are all exposed to. If I'm going to compare the radiation dose from a chest X-ray to this exposure, you will have to have something in the order of 50 chest X-rays at least to get half of that exposure. All right? So the natural radiation is quite substantial. And if you look at this pie chart, you will find that actually the radiation that we receive in general population, that's in the US, that the majority of the radiation that each and every one receives is actually natural radiation. It's background radiation. It's from the earth and from the sun and from the sky. Medical radiation forms a small proportion, 15%, increasing a little bit because we are using more and more imaging for diagnosis of disease and management. But so, as you will imagine, the issue of radiation dose from medical imaging is exaggerated quite commonly. Of course, people who require repeated imaging, people with cancer, for instance, whatever it is, will receive significant doses. But still, we need to keep in mind that there is actually, before that, a background radiation that we are all exposed to. If any of you, particularly the men, wondered what is in a woman's bag, here's an example, and I'm not going to venture on when I sort of explaining all these things. Some are very obvious and some not so obvious, but this is where plain X-rays do help, and this is what they look at airports, of course, when you put your bag in for security. So that was plain X-rays. Now, as I said earlier, the X-ray did not show us soft tissues. So if you wanted to look at the stomach, which is a soft tissue, or a kidney, which is a soft tissue that is not dense, we needed something to help us look at it. And this is where something called contrast studies came in. So the contrast is a medium that allows us to visualize soft tissues better, because they function, because if you either ingest it, swallow it, or you receive it by IV injection, it will be outlining the organ that you want to outline. And as you see here, we have to have a dense element, if you like, so this barium or iodine, and it's either, as I said, done intravenously or orally, and sometimes we even use air as a negative contrast, what we call negative contrast. So what does it look like? Here's how it looks like. Of course, this is an X-ray that shows the solid bones. You will not see the flower, except for that the flower was immersed in contrast and absorbed it, and this is why you see it. All right. So, for detailed imaging of these studies, we needed more sophisticated images. So more sophisticated machines. So this is a machine that's called a fluoroscopy machine, and you'll have a monitor here, television monitor, and you see a live evaluation or live picture of what you're looking at. So here are pictures of the esophagus, the gullet, the marrow, okay? And this is a picture of the stomach here, and this is the white stuff is the stuff that you swallow, called barium, to show the stomach, inside the stomach, and then you can see how it goes through into the bowel here. Okay, so you can see how we look at details of the inside of the stomach, of the esophagus here, and inside of the stomach, and we can diagnose many conditions. For the stomach specifically, endoscopy is now more commonly used than X-rays, but these X-rays still serve a good purpose. And this is an example of contrast that is injected intravenously. And because the kidneys will take it up and excrete it with the urine, you will see the outline of the kidneys here. And these are called collecting system. That's the ureter, that's the tube that takes the urine from the kidneys down to the bladder. And here you can see a normal examination of example of a normal kidney. And here's an example of a kidney that was affected by tuberculosis. And you can see that there's abnormality here. So this is where contrast studies did help. Now we use these contrast studies frequently and regularly, not only in plain X-rays, but particularly in CT scanning and in MRI, and I will talk about that in a few moments. So other examples of injecting the contrast, here's someone who had surgery for gallbladder disease, and they wanted to know if there was any problem after surgery, and this is injected through a tube, surgical tube. And then we needed to be a bit more sophisticated. So we wanted to see more of the organs. What about the blood supply to these organs? There are many ailments that affect blood supply. And this is a picture of the blood supply to the kidney. You can see beautiful appearance of the kidney shape, the bean shape, and you can see the artery to the kidney and how it branches, and you can see all the way out to the edge of the kidney. Beautiful illustration of this. Now, to do that, you needed two things. You needed to use contrast, but you also needed to have a means of entering into the artery of the kidney, and this is where catheters are introduced. So the catheter introduced from the groin, artery in the groin, or artery in the hand, wherever it's more appropriate, and then taken to the appropriate organ, whether it's the heart, the brain, liver, or kidneys. And again, we needed even more sophisticated equipment for this. So equipment that can move around, that can take rapid imaging, and allows you to look at a rapid sequence of images, because the blood flows very rapidly, particularly in the heart, moving heart and all these things. So here are examples of some of the catheters we use. And you can see it's the different shapes, because we have to deal with different anatomy, different people are different sites, so we have different shapes to deal with. I spoke earlier about digital radiography, and this is what I mean by digital radiography, because we have all these digital cassettes. So the receiving medium now is a digital medium. It's no longer a film, an X-ray, a film like the old films. Just like your digital cameras in your phones, now you take photographs on them. This is now what we do. We take X-rays on digital cassettes, and then the X-rays are processed into digital readers, and an image comes out in digital format. And for you, those of you who, I'm sure all of you know, but just a reminder, the difference between analog and digital is a big difference. It's like the difference between old photographs and the current photographs that you see now on your phone, or you take on your digital camera, where you can enlarge, reduce in size, move, play with, whatever it is, because they are composed of little pixels, little components, tiny pixels that you can play with. Any ideas to what this is? A robot, yeah, thank you very much. You can see the receiving antenna here. All right. So, X-rays, radiation. Radiation, there is a risk, and I talked about it. How about using something that doesn't have this risk? Ultrasound. And I'm sure that many of you may have had an ultrasound, or someone had an ultrasound in family, particularly during pregnancy, because this is quite, of course, regular. It's a routine test in pregnancy. How was it discovered? It was actually based on the principle of something called sonar in the World War II. So to discover submarines during the war, they had to do something, because so that they avoid the German submarines, and the sonar was invented so that you send a wave, a sound wave, and if it is reflected from a moving structure, big moving structure, you knew that there was a submarine underneath, and this is how things were used during the war. So this was developed, the same principle, into usage within the medical field. And this will give us views of the solid organs, different planes, like liver, kidneys, fetus, direction of flow, where blood flow is going, and this will be gross anatomy. But gross anatomy is sufficient. And you see here is an example of an ultrasound machine. You see these things that are called probes, and these are the things that actually send the ultrasound wave. And ultrasound, because you don't hear it, it's the megahertz that we use is way beyond hearing, but it penetrates the soft tissues. Okay? And these are different probes that produce different frequency to allow us to see different parts of the body. Because the more hertz you have, the less penetration you have. Okay? So if I wanted to look at the thyroid, I will have a probe with high megahertz. If I wanted to look at the liver, I have a probe with a lower megahertz. So that here's a picture. Beautiful picture, I think. Beautiful picture of the hand. And here's a picture of a liver and the kidney in another patient. All right? See the structure of the kidney here. Look at the white stuff here, the fat within the kidney. Now, if you look at this kidney, see that it has black holes within it. And this is a kidney that is blocked, obstructed. So that's a diagnosis here of a blocked kidney. And let's hope that the beautiful picture of the fetus, don't you think? So much detail of a baby inside the womb, constructed from ultrasound as a 3D or so-called 3D or 4D ultrasound. And the detail is amazing. Even when we were smiling a little bit earlier on, beautiful detail, beautiful detail. Ultrasound, we know all about it now. Let's move a bit. Now we have nuclear medicine, and nuclear medicine is a unique form of imaging because it is the only form of imaging where the radiation source rather, comes from the patient himself or herself. And you tell me, how is that? It's very simple. We inject the appropriate radioactive material into the vein of the patient, and this is collected by the organ that we want to look at, and then radioactivity comes out and is captured on a film. Now, because these relate to organs, they give us an idea about the function of the organ. The previous images that we looked at were actually anatomical. We could look at the shape, perhaps the obstruction of the kidney or whatever it is, but we didn't have any idea about the function of the kidney. These are functional studies. So when they accumulate in the thyroid, they tell me that the thyroid is working well, overworking or underworking, etc. So the functional images come at a price that the detail is not so good, all right? But it's gross enough for us to look at anatomy. Here's an example of a gamma camera, so-called gamma camera, and you see they have a little baby here. So it's safe to use them on little kids. These are, look, again, the radiation dose is not gross. It's not big radiation dose. It's all titrated appropriately. And here's an example of an unfortunate person with prostatic cancer, where the cancer had gone into the bone, and you can see this is called the bone scan, where you see the bones, the skeleton. See all these black spots indicate where the cancer had gone. So sensitive and useful in functional imaging and knowing what happened. I will be talking a bit more about nuclear medicine a little later in my talk. Now, who of you have not heard of CT scanning? Anyone? At some point it was called CAT scanning, computed tomography, and this is another earth-shaking invention that changed, again, medicine completely. And the guy who invented it, an Englishman called Hounsfield, in the 70s, he got the Nobel Prize. So what is it? This is where digital X-rays were actually invented, because he used the X-ray source. But then instead of capturing the information on film, he developed detectors to capture, digital detectors to capture the images. And because of this, it was easier to see things inside. And the design of the so-called gantry, the opening in the scanner, allows something called cross-sectional imaging. So like a slice in the body to look at, and we look at the image in a moment. Detectors were far more sensitive than old films. So you could see things inside that we couldn't see before. Could see through dense tissues. We had detailed anatomy. And the original CT scanner in the 70s would take about 45 minutes to image the brain. The current CT scanners that we have will take less than a second or less than 2 seconds to image the brain. So, you could see the development. We use contrast media. because we need them to pacify, pacify or identify organs. Here is a CT scanner for those of you who have not seen one. That's the opening where the patient goes in. You see this patient has tubes and things, not very well. But it's, as I said, very rapid. And here's what we saw in the first CT scanners that we had never seen before, particularly the inside of the brain, This patient, unfortunately, had a large bleed inside his brain. We had no way of seeing that before CT scanning became available. We had no way of doing it. And because it's digital imaging, you can play with the density, with the so-called window of the, just like you play with your photograph now on the phone. And you can see in this case, we're looking at the bone. We're interested in the bone only of the head. So I can evaluate different parts of the body because of digital form. And because it was initially called computed assisted tomography, CAT scanning, I think people had ideas. I'm not sure whether they actually did materialize or not. But for those entrepreneurs, I think everything is possible. And here's some pictures. Here are some pictures of the inside of the body. So this is in the abdomen. And you can see we can now look at the pictures in different orientation. Here's the liver, for instance, kidney, pancreas, spine here in the back. And here is a picture created from this picture in different orientations, so we look at things differently. And this is what modern scanners do. All right, so you see the detail. Here's a picture that actually would be of interest to those of you who do not believe in smoking, because this is a picture taken of someone who had just finished a shisha. Okay? And you can see the lower part of the lung, that is black, this is normal, and this is the upper part of the lungs, that is abnormal from smoking shisha. All right. So, detail. All right. Now, of course, because we have digital imaging, we can play with it, and we can produce 3D renderings of different structures. Here is a baby that was investigated with CT scanning because they were worried about a bone problem, a congenital problem. We don't normally expose babies, fetuses in the womb to X-rays at all, unless we have to. But this is near term, towards the end of the pregnancy, so the risk is very minimal. The first 3 months, totally out, never. But in this case, we were worried about the possibility of a spine problem, and this is why the CT was done. Luckily, this particular child did not have any problem. But I want to show you a few other examples of what we do now with, if I can get this. So here is a picture of the heart, again taken from CT scanner. And I would like you to look at these, which are the arteries. These are the heart arteries. So no longer is it necessary for anyone to have tamil al-qalb as a diagnostic to see if there is a problem with the arteries. We can do that without a meal on the CT scanner, little injection in the vein, and you get this picture here, and you can see the detail that we see here, beautiful detail. If there is a problem, then the cardiologist can be prepared to go in and do the appropriate treatment, shabakat, stents, balloon, whatever it is, without having to do a diagnostic run beforehand. And the same applies to different parts of the body. So this is, for instance, a picture of someone who has a balloon on the aorta. That's the aorta here. And the balloon is called an aneurysm, and this can rupture and lead to serious complications. So knowing where it is allows us to treat it and plan it. And this is done without any catheterization, which is what we had to do in the past. You saw the catheters before. Now we don't have to do that. Now we can do it just from a simple injection of contrast in the vein in the arm. And One more, if you allow me. So now colonoscopy is required for everyone over the age of 50 at regular intervals. And colonoscopy includes the insertion of a scope inside from the back passage. This is a picture showing you the inside of the colon from something called virtual colonoscopy. So this is also done on CT scanning. There's no scope going down in the back passage. That's just a little tube like the enema. And you can see now how we drive through and navigate through the colon and see inside of it. And if there is a tumor there or polyp, you would see it pretty readily. So this is a way of avoiding the pain and inconvenience of doing colonoscopy. And we're doing it, using it more and more now as a screening method. It's now approved in the US as a screening method for colon cancer. All right? Not only humans, but animals can be scanned, and there's a fracture of the leg of the horse, and a smaller one as well as bigger ones. So this was an interesting problem of this turtle that was discovered on the, can't remember, actually down under Australia, I think. And somebody did an X-ray on her for some reason, and they found all these things. Here's a CT scan, and this is the 3D rendering of the shape of the turtle, of the skeleton of the turtle. And here's our cross-sectional images of the turtle showing normal structures. And this is what was inside. So this little turtle was going on eating all the little coins as she could find, scavenging all the little coins she could find, the base of the sea, and this is where the coins are in its stomach. Yeah. And I think what is most fascinating about CT is the work that was done on the pharaohs. Because the work that was done on the pharaohs in the University of Manchester, the early 80s, illustrated very many things that are of amazing value and deep interest to us about how the pharaohs worked, how did mummification happen, and what's inside all these tombs. And this is, as you see, a 3D picture of Ramesses' skull, of Ramesses II, all right? Done on the CT scanner, from the CT scan image. And this is the X-ray of the brain of Ramesses II, a section from the CT, showing how they dealt with mummification. And you can see here something. So this is a face, this is the skull here, this is where the brain is supposed to be. This is where the eyeballs are supposed to be, and these are the sinuses here. And see, we don't see a brain, we see a layer of something, and we see air here. And we see here, there should be much more bone here than there is a big gap. So the pharaohs invented a form of surgery that we now use, surgeons now use, called transnasal surgery, where they enter the brain and remove something for the pituitary gland, if you heard about it, through the nose. And the pharaohs, 3,000 or 4,000 years ago, invented that. So they would go through the nose, and they would make a hole in the base of the skull, and they evacuate the brain, and put instead something in there, an acrylic material that fills the brain, and this is how they mummified their kings and their mummies. And here's a picture of the mummy inside, and this is how, Ramesses II looked like, and you would recognize the nose, the big nose, of course, because of the, right. MRI. How am I doing with time? Am I all right? Yeah. MRI. Okay. Magnetic resonance imaging. So here is again another test that does not require radiation. We talked about ultrasound, no radiation. X-rays radiation, CT radiation, nuclear medicine radiation. Magnetic resonance, no radiation. All right? So it uses our own body, the magnetic power in each and every cell in our own body. All of us have magnetic potential in each cell. And we are, of course, exposed to the magnetic field, North Pole, South Pole, all these things. So we live our life exposed to some form of magnetism. So here, man invented a large magnetic field. I said, we have a focal magnetic field, and we put the body through it. And what happens to the body if we did that? Or what happens to the cell? So you go inside the magnet, and then the magnet orientation. Now remember, in Earth you have North and South Pole. Okay, so if you put the compass, it will orient always towards the north. Yeah. With the MRI magnets, we switch the orientation intentionally. So the magnet will have north-south 1 second, and then south-north another second. And because every cell is a little magnet, the cell will move with the orientation, move metaphorically. Yeah? And when it moves, it absorbs energy, and when it comes back, it releases energy. So the energy that is released is captured, and that is analyzed, and an image is produced out of it. So you have in the end an image reflecting the different behavior of different cells. So the skin will behave in one way, the bone will behave differently, healthy bone will behave in one way, diseased bone will behave differently. So out of all of these, you get an image. And the image then is displayed and interpreted. So here's an example of an MRI magnet. They have a longish tunnel, but now the modern magnets like this one have a much wider opening than the older ones, and it's much more friendly than the older ones. And I tell you, I am claustrophobic, and I've been inside the magnet several times, so I know exactly how it feels.
No, they have some open ones.
They are open ones, but the problem with the open ones is that the magnet strength is not very good, so the images are not terribly good. They give much inferior images, but they serve for some people for small purpose. So here's a picture of the inside of the brain, and if you look at the detailed anatomy that we can now see, this is called the pituitary gland, and this is called the brainstem here, and these are the surface, the gyral surface, the surface of the brain. You can see every single one. The amazing detailed anatomy, of course. Not only amazing detailed anatomy in the brain, but outside, like shoulder here, where we see abnormality in the shoulder bone here, in the humerus, or in the spine, where we're no longer hindered by the bone here. We can see a patient that has a little tumor in the spine here, which we could not see before the bone was in our way. Or in the body, here's a picture showing a liver شهوة يعني hemangioma مثل الشنية وشهوة جوا. Okay, you can see the pancreas, you can see the kidney, you can see what. So detailed anatomy and detailed assessment of the pathology has not replaced CT. Each one of them plays a different role, complementary in many times. So one will give us some information from one aspect, and the MRI will be from a different aspect. All right. MRI tends to give a bit more information about functionality than CT. CT is purely imaging. MRI is actually, there's an element of functional assessment. Okay. So as you see, it's a beautiful assessment. Now there's much more, because on the MRI, because of the way we look at the composition of the cells, you can look at the chemical composition of the cell. So you have something called spectroscopy. Yeah, and the spectroscopy will tell you the different components of the cell, lactic acid, glucose, etc., creatine, and all these spikes and things represent different aspects of the cell composition, biochemical composition of the cell. And we know from different diseases that, for instance, someone has something in the brain and we're not sure whether this something in the brain is a tumor or whether it is an infection. The spectroscopy, depending on which component is prevalent, will tell us whether this is an infection or a tumor. Here's this part of the brain here that we are interested in, and we're looking at it. So beyond imaging, you have chemical assessment and functional assessment. And even more, this is a beautiful illustration of what we do see today, we can achieve today, of all the complex connections within the brain. So this is a normal brain, and these different colors and different lines reflect the complex connections inside the brain between different parts of the brain. Some will be for vision, some will be for hearing, some will be for speaking, some will be for function, for motion, and you can see some of them go from the brain to the spine, to the brainstem, to the spine, and some stay in the brain itself because they serve different parts of this. And one other patient, there is asymmetry, not symmetrical. They're different between the two parts of the brain because there is interruption of some of the fibers and the pathways within the brain in this particular patient. Again, very advanced way of looking at function of the brain. And what is the clinical application of this? What is the typical application of it? Here is an application, for instance, where we look at receptive language. So you do an MRI while you're speaking to the patient, okay? And you define these red spots, define the areas in the brain that are responsible for speaking. And we can tell that in this patient who had had surgery on his brain here, that there is potential of recovery of speech after surgery because he has some speech ability on this side, which is away from the side that he had the surgery on. All right? More relevant is planning surgery. So here's another patient who has a tumor in his brain. All right? And here we're looking at movement, motion. So we do the MRI as we ask the patient to move his hand. All right? And we look at the area that is responsible for this. And you can see that close to the tumor, there's this area that is responsible for hand movement. So when the neurosurgeon will go in to do the operation, he will make sure that he will not touch this area. So it's called functional MRI imaging. Functional MRI imaging, all right? There's no end to what you can do in terms of analyzing the imaging. And of course, as the imaging becomes more and more sophisticated and more precise, we have more abilities to look at more into the inside of the brain, inside of the body, not just the brain, in this case the brain, and analyze what's going on. And MRIs come in different shapes because MRIs are also used in the industry to look at certain aspects. So you need a large MRI like this, and they come as small as this for pediatric use. So we do have different things. Opportunities to be had. Well, now interventional radiology, and I think very few people would know enough about this so-called interventional radiology and what is it. And it is image-guided treatment, image-guided surgery, if you like, and the interventional radiologist, and this is one of my fields of interest, is the surgeon who is effecting the treatment under the guidance of imaging. So we use the imaging. You can say now that the cardiac, when they do tamyil al-Bushra, is some form of intervention because it's image-guided, and very few people know that the cardiac dilatation and ballooning and things was invented by radiologists and was used to be performed by radiologists, and now cardiologists do it, and I was one of them. But there's a different procedure that we can, in different body organs, range from simple biopsies to complex treatment of diseases of arteries and tumors and everything else. It's a very wide range of intervention. Here's, for instance, a patient who who had pain in his leg and required infiltration of the nerve in his back. And this is, you can see the needle under CT guidance. So this is a CT image, and the needle is placed in the appropriate place because you are using the CT as a guide, precise guide where you're going to treat. This is the first case that was done in the Middle East back in 1999, and I'm honored to have done it, of someone who had an aneurysm of the aorta. So this is the big artery in the chest, and this big bulge here was about to rupture in a young patient, 22-year-old, and this was treated without surgery by inserting what we call a stent graft, a شبكة مغطاية يعني, that sealed the aneurysm. That was in 1999. I saw her actually last year, and she's still doing extremely well, thank you very much. Other examples of this is in the artery going to the brain, where there's this severe narrowing that affects the blood flow, and you can put a stent, شبكة, in it, and that's open it up. And you can also use something called the filter. So this filter here will be placed to capture any little clots or things that are attempting to go out, and you take it out. So we protect the brain at the same time as opening the blood flow into the brain. And aneurysms happen everywhere. When they happen in the brain, they lead to serious consequences if they do burst out, the rupture. The treatment of the original treatment was surgical treatment by placing a clip, which involved opening the brain, opening the skull, what have you. Now the modern treatment is just similar to what you've seen in the aorta, where we go in and with the catheter inside the artery of the brain, and place all these little coils inside that block it. And if you look at the picture down here, you see what I'm referring to. This is, the aneurysm is filled with all these little coils, and there's an addition of a stent there to help. All through a catheter without having to do any surgery anymore. Not all patients are suitable, but certainly now the vast majority of them receive the treatment this way. Now, how about, oops. Treatment of tumors. Here's one way where radiologists can help, also interventional radiologists. Here's a patient who has a tumor in his liver, and the tumor in the liver here is not suitable for surgical resection. And you can see how we go in under the guidance of imaging, reach the appropriate location, put little thing in there to allow us to burn the tumor within the liver. Okay, so as you burn it, you kill it. And this is one way of treating some of the tumors, of course. How are we doing? You all right? We're all right in time? Okay, a few more minutes. So I'll take you back now to nuclear imaging, all right? And I want to talk to you about something called positron emission tomography, or PET scanning, that many of you will have heard about. And this is all about molecular imaging of the molecules, and something called theranostics. So theranostics is a new term in medicine, and it's really a combination of therapy and diagnostics. Theranostics. So similar to old-fashioned nuclear medicine, the patient is the source of radiation here, all right? And we give something called, but the radiation is different. Instead of beta or gamma, instead of gamma radiation that we use with the old nuclear medicine standards, we use beta radiation with PET scanning. The patient is the source of radiation after we give him the injection into the vein and then image. And most common element to be used is fluoride attached to something else that is, in this case, FDG for tumors, and it's related to glucose metabolism. And we look here at imaging of tumors, which is the bulk of PET scanning used currently. But we look at cardiac disease and we look at brain disorders also at PET scanning because of the functionality. We can assess function. And the therapy diagnostic is for targeting disease. So theranostics allows you to identify the disease and target it with a treatment at the same time. Okay, you will hear more, this word mentioned more and more in the future. Here's an example of a PET scanner. Currently, the PET scanners are combined PET and CT in the same machine. And the reason for this is this. The PET scanning will give you an image like this. Okay, so you will see the activity in this case, in this patient's case, this is tumor in the lung, this is normal heart, and this is normal kidneys, normal liver. But it doesn't give you enough detail about the anatomy. So the CT scan comes in and gives you details about the anatomy. And then when you combine the two, you get something called a PET-CT, which is a combination that allows you to look at both the anatomy and the function at the same time, be very precise of what you're looking at. Where else does PET scanning help? As I said, in the brain conditions. I mean, here's, for instance, assessment of depression in psychiatric patients. And you can see the normal brain activity in a normal person and the different activity in an abnormal person. But what is more and more exciting currently, anyhow, is the role of PET scanning in Alzheimer's disease. Okay, so we are now at a phase where we can almost detect early stages of Alzheimer's by PET scanning, and this is being developed still in the pipeline. But you can see here the difference between a normal brain and an Alzheimer's brain in terms of activity and what's happening here. So, and this is something called cognitive impairment, which is more like خرف الشيخوخة, يعني old age. Yeah. So this is very exciting. I think Alzheimer's disease research is very, very exciting. So we can tell you what's real from what is not real. Yeah, in imaging. But can we, do you think, disentangle all the fibers and things inside the human body, like this carpet, weave in the carpet, and see exactly where things are? You might see names similar to mine here, and similar to my wife's inside this carpet weave. Can we do the same inside the brain, inside the body? Well, we can already read your mind. And let me tell you, I have not finished. Let me show you this fascinating video. So on the left-hand side is an image shown to a patient, and then an image constructed on the right-hand side from images of the brain to reflect what the person has seen before. And look at the similarities. So what you're seeing here is actually interpretation of your thoughts from images, and that's on the right-hand side, compared to what you actually are thinking of on the left-hand side. So you can see that we can read your brain, we can see the inside of you, and we can treat you. Thank you.